Hi, this is Dr. Ghurani from Body Aesthetic Center. Welcome to our Plastic Surgery Center. I would like to take this opportunity to kind of hit on a very sticky point that has been coming up lately in the last few days. And I felt like I need to communicate with my patients and my prospective patients and the whole community of cosmetic surgery in general. We always take our patients' health and safety very seriously. So in the pre-op period, you obviously have learned through communicating with my pre-op coordinators that we order a set of labs that are very comprehensive to be able to get to know you very well and get to know your physiology and all your numbers that are very important for us to evaluate you as a candidate and make sure you're good for surgery. We also get medical clearances and so on and so forth, EKGs, chest x-rays, and all the appropriate tests so that we optimize you and make sure that you are going to go through this without any issues. Now, we also, to be specific, we test for nicotine because nicotine is a chemical that, without getting into too much detail, is obviously a dangerous chemical that causes damage to your lungs and makes it difficult for you when you're going through anesthesia and recovery. And also remember that nicotine has a lot of different chemicals that cause the vessels in your skin to become tight, and the oxygen is not delivered efficiently to the areas that have surgery. So those areas might get compromised blood supply, and then you can lose some skin. So that is one concept that I wanted to bring up. And lately we've had a lot of patients that were smokers, and we understand everybody is has to deal with their own habits, but this is surgery, and I would like you guys to take it very serious. It is a major surgery. So when we ask you guys to please stop smoking, we're going to test you, and we try to be as upfront as possible. We're telling you what we're testing you for. So if we give you the instructions to stop all forms of tobacco, hookah, etc., chewing tobacco, vaping, all these new electronic cigarettes, please stop them, because we will test you, and we will test you at a point that the day before surgery and after surgery. So please, try not to work yourself around that. Do not bring in fake urine, which unfortunately some patients have done, and try to bypass the system, because the only person you're hurting is yourself, and then constantly giving me and my staff complications which are not necessary for an elective procedure. This is, again, an elective procedure. It's a cosmetic procedure, but it's a very serious procedure. So it's not an emergency, so please take the time to allow your system to clean out. Now, that has been the more frequent issue that we faced, but aside from the smoking and tobacco products, we have been faced by a few situations where patients have consumed drugs, illicit drugs, and namely amphetamines, methamphetamines. They come in all different forms, legal, that are prescribed by physicians, like the Adderall and the Vyvanse, and all these medications for attention deficit disorder. Again, I feel like that medication and amphetamines and methamphetamines are medications that can irritate the heart, and I do not want to put a patient through a procedure, and which I consider a very serious procedure, and stress them out to the point where if they have an illicit medication, or even if it's prescribed amphetamine derivative, can cause an irritation and a heart arrhythmia. And I understand some doctors might not push this issue so much, but in my clinic, in my practice, under my supervision, I really do not want to have any extra compromising factors or variables that could affect the outcome. And your health and your safety and the ultimate success of this procedure is my first priority. I don't want anything bad to happen to my patient while they're undergoing an elective procedure. And the one more medication that has come up, or one more chemical that has been coming up lately, is the use of cocaine. Again, our practice is not here to judge you as a person. But the side effects, the pharmacological effects of cocaine are very serious on the coronary arteries, okay? And the effect under anesthesia can be actually detrimental and can actually compromise your life. So in that situation, please understand that when we find illicit drugs like cocaine and methamphetamines and other illicit drugs that can affect your physiology and your heart, we are going to cancel you. And I understand that patients have traveled a long distance, have paid a lot of money for flights, for hotels, for nursing care, and for our procedure itself. And trust me, we appreciate your business. We appreciate the sacrifice you guys go through with work and time off and so on and so forth. But ultimately, all that aside, your life, your safety is my first priority. So I'm, as your physician and your future physician and surgeon, I will not hesitate to cancel a patient that has any of these medications that could affect their affect their life. So please listen to us and take this seriously. We will test you and we will not hesitate to cancel. I'm sorry to be so serious. I try to be as jovial and as personable as possible and try to make this as pleasant and as a fulfilling experience possible. This is something that we want to be happy and improve your shape and have you come out of here feeling positive, but we do not want to have any situation where the patient ends up being compromised for something that's not necessary, but something we desire. This is a cosmetic procedure. This is not trauma. This is not a cancer. This is not something that a patient has to undergo, and regardless of what they have in their system. So again, please be upfront. Let us know. This is everything you put in your chart or you discuss with me or my staff is confidential. This is not something that we advertise to anybody, regardless of who it is. The Patient Privacy Act is very well respected in this practice. So if there is anything that is potentially could compromise your health, let us know so that we can protect you. And I hope this message is as serious as it sounds, gets through to everybody, and makes you understand that it's not something that I do because I just want to cancel a patient. Trust me, if you've made it this far to Miami and you're in our clinic, in the pre-op room, ready to go into the OR, it's because we've already vetted the patient. That means we've actually looked at your pictures. You've initially went at the point of sale. We've actually looked at your medical history that you've provided. And then in the pre-op period, after the patient has signed up for surgery, we go through, as you guys very well know, the medical clearances, the notes from the doctors, and your actual laboratory results. So it is a very lengthy process, involves a lot of man hours and a lot of personnel that take the time and effort to provide to me the things I request to make you ready for this procedure. So definitely appreciate the fact that you guys have the sacrifice and the time and the cost to come down here, but there is also an effort and cost and time put into getting the patient ready for surgery. So it's not anything but a loss situation on us. We lose a good patient, and you guys lose money and time. So please, again, I know this has been a little bit of a lengthy video, but please pay attention. Try not to circumvent the system. It's for your own good. Okay. Looking forward to seeing you guys at Body Aesthetic Center. Thank you for your time. Have a good day.